You might be wondering, how do I go about getting this wonderful MRT test done? First of all, you're going to want to find an MRT dietitian to order the test for you. Now, if they're like me, they're going to want to have a brief conversation with you just to make sure the testing is a good fit for you in your situation at this time in your life. After that conversation, I can usually go ahead and order the test, have it delivered to you, and I'll also find somebody who can do the blood draw in your area. Now, if you're near me, I have a couple of home health nurses that will come to you to get that draw done. But there are also labs located all across the country that are happy to do the MRT draw. So there's no prep for getting the draw done. You don't have to eat a certain way, restrict foods, include foods. No, we just want your immune system as is. My most common advice is to drink plenty of water before your draw. After the draw, we'll get your results in about a week or so. And by the time I do all my prep, getting your food list ready and all that kind of stuff, we will go over your results. Now, in the meantime, I will have an initial consultation with you. And at that initial consultation, I'm going to have a keen eye for what might have caused food sensitivities for you in the first place. Because we're going to want to take care of those underlying root causes so that you don't just keep getting food sensitivities again. Now, as an aside, during your MRT food protocol, I'll also be working on improving gut health with you, and that also is going to help decrease the likelihood of future food sensitivities. So, but back to that, we'll have your initial consultation, and then a week to 2 weeks after your blood draw, we will have your MRT results consultation. So at that time, you'll find out exactly what you'll be eating for each little phase or segment of your food elimination and reintroduction plan, all based on your immune system. And you'll just kind of have a big picture of what that's going to look like for the next 40 days and all the way up to 3 and 6 months. At that time, you can decide when you want to start your MRT food protocol. So some people want to start right away. Maybe they feel badly and they just want to get over it. Or they have a big event coming up in 2, 3, 4 months from now and they want to be all done and eating a good variety of foods before that event. Or on the other hand, they may have a big event soon, a wedding, a cruise, whatever, and they want to get done with that event and then start the food plan. Either way, in my practice, once you start your food plan, then you will get 3 months of support from me from when you start your food plan. So if you don't start right away, no worries. That 3-month countdown does not start until you start your food plan. So what I do is I have a whole program designed just for going through the food plan based on your MRT results and also for restoring gut health. That program includes videos and handouts and all the information you're going to need to go through that plan. And then not only the initial consultation and the MRT results appointment, but we'll also have a 6-week check-in and a 12-week check-in, all with specific goals in mind for each of those visits. In addition, you'll get chat support through a HIPAA-compliant chat with me so that you can ask questions about anything pertaining to your MRT foods, your symptoms, whatever. And plus, I'll send you some symptom surveys at specific intervals just so I can keep an eye on exactly how things are going. Now, if at any time you want additional support, like you want to talk to me one-on-one, we can do that too. There's an option for that as well. So, um, that's it in a nutshell. Most of this is not covered by insurance, but I have found for me and those in my family that many of the health purchases I make are not covered by insurance, but they have been the best thing I have done for my or my family members' health. Now, the test is not covered, or it might be covered with HSA or FSA funds. I can certainly use that for the entire package, but also individual appointments might be covered by your insurance, though it will be out of network. Not only have I helped literally hundreds of clients go through the MRT food protocol of eliminating foods and then adding them back in, making it fit their unique needs and lifestyle, work requirements, whatever. But I've done this plan myself twice and also had people in my immediate family that I was cooking for to do the plan as well. Which means if you're looking for someone who can make these test results work for you and your unique situation, I'm your girl. All we have to do to get started is book a free 20-minute chat with me. I'll make sure this is a good fit for you and your situation right now, and we can likely get started right away.